Hi, everybody. A very, very good afternoon, and welcome to this session, which has been organized by Cordlife in association with Dr. Ganga. Thank you, Cordlife, for giving us this opportunity of, having this platform. And thank you, Dr. Ganga, for giving us the opportunity to interact with all of you lovely mamas. I'll give you a very quick introduction about myself. My name is Sonali Shivlani. I'm a pregnancy and postnatal consultant. I'm based out of Mumbai, and I have been working with mothers for 16 and a half years now. So I pretty much have been doing pregnancy, post-delivery, lactation, nutrition. All of these are my areas of interest. I'm also a mother. I have two kids of my own, and my son is going to turn 20 this year. My daughter is already turned 18. So I have two adults. However, I still kind of, think of them as children, and I still feel I'm on that parenting roller coaster. You guys have just started off your journey, and it's only going to get better. But what we are here to do today is talk to you and show you some simple exercises which can help to make your pregnancy much more comfortable, prepare your body for labor and delivery, and also help to speed up your postpartum recovery. So that's a lot of advantages, isn't it? So keeping that in mind, we will be actually demonstrating the exercises. So I would really love it if all of you can also join in. A couple of things. We have kept you on mute, so you will not be able to speak during the session. However, if you see on your dashboard, there is a questions box. So you can put all your questions in that, and we will make sure that we answer all the questions before we close the session. So put in a lot of questions related to your exercises and etc. Dr. Ganga will also be joining us in the latter half of the session. So you can put in some questions for her as well. So these are all the things that are required. A couple of things that you will need if you're going to practice with me, and I would love it if you practice with me, is a mat. If you do not have a yoga mat, then you can use a thick bed sheet. So you can get that organized. And if you have a firm chair, or if you can be close to a wall for support while you're doing the squats, etc., then that will also be very, very helpful. Okay. So I'm going to give you a couple of minutes to get these 2-3 things organized: a bottle of water, a thick bed sheet or a mat, and either be close to a wall or a firm chair, so you can keep your screen accordingly, so that you can watch what I'm doing as well as practically try it also. That's what is going to make you an expert, isn't it? Because in this pandemic, you have to do this workout at home. So just get going and get all these 3 things organized for me, and then we'll get started. Just a couple of minutes. All right. So that's awesome. I am sure that you're all ready and set. But before we start with the actual demonstration and you guys doing the practicals with me, there are a few basics that we must cover. So again, back to that very quick introduction. Sonali Shivlani, for those of you who have joined in late. I'm a pregnancy and postnatal consultant in practice for more than 16 and a half years now, and a mother to 2 kids, right? And this session has been brought to you by Cordlife in association with Dr. Ganga. So thank you so much, Cordlife. Thank you, Dr. Ganga, for this amazing opportunity. And thank you to all the moms who have made that special effort and who are here on Sunday afternoon, right before lunch. I'm sure it's a very busy and hectic morning at home, but I will make sure that you definitely get great benefit out of the next 1 hour. So pregnancy is divided into 4 stages. We have the first trimester, which we say is from 0 to 12 weeks. The second trimester, which is 13 to 27 weeks. The third trimester, which goes from 28 to 40 weeks. And we also have the fourth trimester, which is the last 3 months. And this is your postpartum phase, because you're going to be recovering at this point of time, and you need to take care of your health and your body even at that time. So some of the exercises that I'm going to show you, I would want you to do in the post-delivery period as well, which is why this fourth trimester has been mentioned over here. It's very important that before you begin any exercise program, you should always consult your doctor. That is something which is important. Now, when I'm saying consult your doctor is going to make sure that your pregnancy is healthy. They'll check your ultrasound reports, they'll do a physical exam, and only then give you the green signal to do all your exercises. This kind of a request or checkup or question from your doctor should come every visit. So even if your doctor's told you, say in the fourth month, that yeah, everything is all right, please exercise and do all your activities, still, when you go for your fifth month checkup, ask again, because pregnancy can change and the doctor may not remember what instructions were given to you in the last visit. We see so many mothers, isn't it? So it's a good idea that you always ask that, okay, this is what I've been doing in terms of exercise. Can I continue in this month also? So that's a very important thing from your end that you have to be careful and cautious about. It's also essential to keep these few things in mind. Start slow. There's no rush. Even if, your friend is doing 100 squats, it doesn't mean that you have to do 100 squats on the first day. So always start with a few squats, always start with a few positions. Don't do something in a big rush. It's always better to do less counts, but make sure that your posture is correct. So even if you become an expert and you've been doing it for the last 2-3 months, it's still a good idea to be very cautious of your posture. When you start something new, don't do it unsupervised. So that is one of the major reasons why Dr. Ganga wanted to have a session like this, so that we could actually demonstrate the postures and give you the correct positions, so that when you're doing them, you're not making any mistakes. And just for the record, Cordlife team is going to be sharing the recording of this session with you. So you're going to have this for your reference. So don't worry, it's all going to be there for you to take a look at even after the session is over. At any point of time, if you feel any discomfort, stop, right? So if you're feeling that I'm getting a little cramp in my abdomen or a little pull in my buttocks, just stop, because we never know when you can cause an injury, and that's not something which is worth it. If you notice any of the warning signs, which I'm going to talk about, stop. That's the important part to keep in mind. So pregnancy doesn't throw huge surprises at you, but if you ignore your signs, then you're definitely going to have a lot of surprises. These are some of the warning signs that we would like you to watch out for. The first is abdominal cramps. In fact, any kind of pain in the abdomen. Sometimes it could just be gas, acidity, a muscle pull, that's fine. But it is also worth getting it explored, because there is a possibility that it could be contractions, and contractions need to be investigated by your doctor. If you feel any kind of liquid, that's water leaking, it could be the amniotic fluid. This can happen more prominently in the last trimester, but always be alert for this. Any changes in your vaginal discharge, if it suddenly becomes excessive, you get a lot of mucousy type of discharge, you're constantly feeling damp, then this could also be a warning sign. Vaginal bleeding is also something you should report immediately. So yes, maybe a little bit of spotting in early pregnancy can be considered to be the implantation signs, but at any other time of pregnancy, if you see any kind of bleeding, always get it checked. Any other abnormal signs that you feel, okay, I think this is not right, then it's absolutely something which has to be explored. Sorry, please excuse that. These are some of the myths that are there about exercise. First and foremost, exercise will cause a miscarriage. Not true. Let me tell you what I mean by that. There are two components which are going to work for your delivery, for the actual birth. The first is your pelvis. So pelvis is this, it's kind of shaped like this. When you feel your hip bones, that's part of your pelvis, right? There's the second factor, which is the mouth of the uterus, which we call the cervix. Now that's deep inside. There is nothing that we can do to influence the cervix, but we are definitely trying to make your pelvis more flexible. So exercise does not impact the cervix and therefore is not going to cause a miscarriage. Exercise does not make your baby grow lesser. Exercise will not impact fetal development. Exercise will not exhaust you. Yes, in the beginning, it is a very good possibility that when you first work out and you've not done anything for the first 3-4 months of your pregnancy, then you might feel a little tired, but slowly this tiredness will go away. Exercise is not going to overheat or dehydrate you. Weightlifting, that means light weights, can be done for the upper body. So very light weights, but only for the upper body is absolutely fine. Some women are put on bed rest and then they completely don't do anything. So it depends on what kind of bed rest you are on. If the doctor has even restricted your going to the toilet, then of course we can't do much. But still, some amount of movements will actually keep your muscles active. So even if it means, doing things like this, stretching and, moving your calves and your ankles, that's something which you must keep in mind. Okay? Cool down and warm up, both are extremely important. Don't just start. Just because you know that squats are a good idea doesn't mean you start doing 100 squats and then just go sit down on the couch. It doesn't work that way. So you have to warm up and cool down to ensure that you do not have any injuries. Let's talk a little bit about prenatal exercises. Here are some of the benefits. It's going to help to reduce your aches, pains, discomforts, especially back pain. It boosts your mood, improves your energy levels. Imagine that. I think all of you must be experiencing this, right? I feel lazy. I feel like sleeping. I feel tired all the time. So this is something which will really help as far as exercise is concerned. Interestingly, it actually helps you to sleep better also. Excessive weight gain is also prevented. Stamina and muscle strength improves. Pregnancy complications, things like hypertension, thyroid issues, gestational diabetes, these are greatly reduced when you are exercising regularly. Your labor and birth is much more smoother and your postpartum recovery is also much more faster. If you don't know what to do, right? I mean, even after doing this session, if you're still confused, think about a walking program. When you're doing a walking program, it's safe, it's convenient, it can be done anywhere. And the good news is you don't need any supervision. No one needs to tell you how to walk, isn't it? So no kind of walking program, any kind of walking program can definitely be started. But there are a few things you should keep in mind. I have seen women during pregnancy, just because everyone's told them you should walk, it's very good for you to walk, they will just go for a walk wearing anything. So they're wearing their chappals, they are just wearing any clothes. So be careful. Make sure that you have comfortable walking shoes. You won't slip, you won't have falls. Your feet, your ankles, your knees, all will remain comfortable. Cotton clothes will ensure that you don't get overheated. Eat a small snack, plus carry a bottle of water. Don't go on an empty stomach. It's okay when you are not pregnant to do all of these things. But when you are pregnant, you cannot go hungry. Okay? Walk at a pace which is comfortable and brisk. You're not going for a stroll. What you're going for is a exercise walk. So if your friend calls and you can gossip away for the next half an hour, that's not your brisk walk. When your friend calls, you should start feeling breathless if you talk, so you will want to hang up. But however, you should not get breathless in your regular walks. If you're not talking and you're walking, you should be able to breathe fairly easily. It's important to listen to your body. So we want you to do about 30 to 45 minutes every day. However, if on a particular day you're tired, you can skip, or you could do 15 minutes, or you could do 15 minutes, sit down for a little while, and then do another 15-20 minutes. So you can do it in breaks as well. So that's something that you can keep in mind as far as a walking program is concerned. Okay, so now what we're going to do is we're going to move into the demonstration. So the first thing that I would like to show you is posture. Okay. So I'm going to keep my chair here on the side. We'll start with your standing posture first. And posture is one of the major reasons why people have back problems during pregnancy. We are always complaining that we have a backache, right? So posture is something which will really help you as far as your back issues are concerned. So I'm going to start with that. Now see what happens. This is a normal woman. As you can see, I do have a little curvature in my back, right? So this little curve is very normal and it's natural. All of us have it. It's part and parcel of our body. But what happens during pregnancy? The stomach size is going to increase, which means this is what is happening, right? So as you can see, the curve in my back now has increased dramatically, right? And over and above that, your chest size also increases, due to which what happens is your shoulders tend to droop forward. So now what does your pregnancy posture look like? It kind of looks like that. And that's very, very uncomfortable for your entire back, right? And then this is normal, where your shoulders are all nicely pushed back and you're standing erect and tall. So taking care of how you stand becomes extremely essential. And here's what you have to do. Make sure that when you're standing, make sure that you kind of stand erect, push your shoulders back, and push your chest out a little bit. So while standing and walking, this is the posture that you have to employ. Okay. The second thing that we're going to talk about is your sitting posture. So now let me use my chair and I'm going to change the angle just a little bit so you can see how I position my feet also. Now, the sitting posture is very important for women who are working. Don't worry if you cannot see my face. You have to basically see my back and how I'm sitting. So when you're a working woman, most of the times you're sitting for 7, 8, 10 hours.
Excuse me, ma'am.
Yes.
Ma'am, can you adjust your camera, please? Little bit upward.
No,
little
but
bit upward.
Ashutosh, I want to show my back and feet.
Your face is cutting off.
But face nahi hoga, so it's okay, na? That's fine.
Okay. Done, ma'am.
Yeah. That's what I mentioned first also, that don't worry if you can't see my face. The main parts that you have to see is here. Okay? Alright. So, when I'm a working person, I'm sitting on a chair for almost 7 to 8 hours, 10 hours in a day. If I sit uncomfortably, I'm going to get back pain. What I see most women doing is they slouch. They sit like this. And this is going to cause a lot of pressure on the back. The other thing that happens, now my chair is pretty decent, right? My feet are touching the floor. But most office chairs are not like that. With most office chairs, your feet are dangling. So most women end up having swelling in the feet, pain in the back, a lot of discomfort. These tiny pillows are your best friends. So what you have to do is, you should position the pillow, support, make sure your buttocks are comfortable, and now your back is tall and erect, right? So this is your sitting posture with your feet flat on the ground. All right. So now you'll be able to see my face. Now, as I told you, warm-up is very, very important. So I'm going to show you a few simple stretches which you can use for your warm-up and then also your cool-down. Okay? Now, the best way to remember these stretches is head to toe, whatever can move. Sounds simple? So whatever can move, head to toe, is what we're going to try and move. And the first thing that I'm able to move is my neck. So let's start with that. Very, very slowly. So what I'm going to do is, I'm going to do 2 or 3 counts of each of the positions. I'll do them super slowly, and I would like you to do it with me as well. All right? So slowly, holding yourself nice and erect. Drop your chin to your chest. And slowly drop your head back. Feel the stretch in the front of your neck. Once again, forward. Please note how I'm doing it super slowly. And back. Come back to your starting position. Go to the left. The reason I'm doing it so slow is so that my head does not spin at any point of time. I don't get a dizzy spell. Okay, during pregnancy, that can be very, very common. And left. And once again, right. Come back to your starting position. Drop your left ear to your left shoulder. Don't move your shoulders. And right. And left. And right. And now I'm going to make you do full rotations. Come back to your starting position. Chin to chest. Left ear to left shoulder. Back of the head to the back. Right ear to right shoulder. And chin to chest. And we're going to reverse it. Right. Back. Left. And chin. And come back to starting position. Right. The next area which moves is your shoulders. So let's do nice shoulder circles. 1, 2, 3, and 4. Reverse the circle. 1, 2, 3, and 4. So that's the thing that you have to excuse my cough. I've actually been naughty over the Diwali weekend, had lots of iced beverages, and it's showing up on my throat and my nose. But rest everything is okay. All right. All right. We can also move our entire shoulder joint. So we could do something like this. 1. This is also excellent for your chest. 3. And 4. Reverse it. 1. 2, 3, and 4. One more exercise that I would like to show you to help prevent sagging of the breast is bring your hands in the front, join each hand with the other, keep your arms at shoulder height, and fight. When you do that, you're going to feel a nice stretch right here on the side. So stretch and release. Once again, fight and release, fight and release, right? Stretch your fingers out. This is again excellent for someone who works a lot at the computer. Make a tight fist. 2, make a fist. 3, fist. 4, and fist. Circle. 1, 2, 3, and 4. Please note I'm doing it so slowly. I'm not in a hurry. Reverse the circle. 2, 3, and 4. Some simple stretches which can also include doing this, stretching your arm across your body. First one way and then the other way. And always hold it for a couple of counts. Don't be in a rush to get into the next stretch. Feel that stretch. Okay, arm overhead. You feel the stretch on this side, the other side. Amazing. We're going to do the zipper stretch. So we're going to take the hand and imagine you're zipping up your favorite dress. So join your hands behind and we're going to try it with the other side. Lovely. That's perfect. One last stretch. Get both your hands together, take them behind, and this is what you're doing, the namaste, right? If you can touch your neck, I'm going to be super happy. So the biggest advantage of all these stretches is that it improves the elasticity, the space, the flexibility in this area, which is going to ensure that, you know, when your baby is in the 9th month, you don't feel too much of pressure, pain, discomfort, breathlessness, acidity in the ribs area, right? So a lot of benefits for doing these stretches all throughout your pregnancy. Okay, Now, the next thing that we are going to look at doing is some exercises which can help to, just do some stretches. Many women have these questions, can I do this, can I not do this, and etc. So let me show you a few stretches which are allowed and a few stretches which are not allowed. Okay. So now, if I have to pick up something from the floor, what do? I could pick it up, but normally when I'm not pregnant, this is literally what I'll do. But when I do this, I'm putting so much pressure on my abdomen, which is not recommended, right? So when I'm pregnant, the best way to pick up something from the floor, you got it, it's a squat. So I go close to the object, I slowly squat down, pick up the item, and then I slowly stand back up. Now, it may not be possible every time that you can do a squat. So the other thing that you can do is spread your legs really wide, back flat. So now there's no pressure on the abdomen, and slowly reach forward and pick up the object. Do not bend from the waist. Use your buttocks and use the back of your legs. So this kind of a stretch where your back is nice and flat is allowed. When you reverse this is great for your lower back. It will help to give your lower back a great stretch, right? When you're standing sideways, you can do a twist like this and a twist like that. And you could also do this, right? Amazing. And we can do it the other way too. All right. So these were some simple warm-up stretches that you can do right in the beginning or in the end of your workout as a warm-up or as a cool-down. The next few exercises that I'm going to show you are specifically designed for preparation for labor. And the most important one is obviously squats. So that's a standing posture. I'm going to show you how to do it. And then we're going to lie down on the mat. Now, if you don't have a mat and you're doing this on a bed sheet, keep the bed sheet aside because there's a chance that you'll slip. A yoga mat is fine. You can do it on a yoga mat, but if you're doing it on a bed sheet, then please keep it aside. Okay? So I'm using a nice and firm chair. That's what I would recommend that you also have handy. If you don't have a chair, that's perfectly all right. You can take support of the wall as well. And then if the wall is not available and sometimes your husband is, then you can take support from your husband and you can hold on to his shoulders and do your squats. The main important thing is don't put your weight on either the chair, the wall, or the husband. You are going to just use this for support to maintain your balance. Okay? So now we're going to imagine that the chair is there, but because I want you to see my positions, I'm going to move my chair aside so that you can see what the exercise looks like. Okay? So imagining that there's a chair right here, I have my legs nice and wide apart, and all I'm going to do is go down tall and straight and up. So it's imagining that I'm holding that chair and up and down and up. And see, I'm doing it so slowly and not doing it in any rush. Okay? Now, there are two things that I want you to take care of over here. The first is the angle of your knees. So now if you see, my knees are going in the same direction that my toes are pointing. So my toes are pointing out, my knees are also going out, right? If my knees get pointed like this, that means they come forward like this, I will get knee joint pain. How many squats should I do? You can start with 8 to 10, but as your strength and stamina increases, you can build up to that number of 100 that I mentioned somewhere in the beginning of the class, right? So let's take a look at it again. This was the first thing. Your knees are pointing outwards. Imagining the chair, we're going out and up. Got it? This one is something which you're going to be advised to do a lot of. So it's important that you do it correctly, right? and 3, and 4. That's perfect. Okay? All right. Now, there's one more thing that I want you to make sure that you take care of. When you come up, don't lock your knees. Don't make them completely tight. Let me give you a quick demonstration, okay? So this is down. When I come up, my knees are soft, okay? Watch when I lock my knees what it looks like. So I go down and I come up. So this is soft knee, this is locked knee. Soft, locked. So when you're doing squats, always keep your knees soft. So when you do that, you will definitely ensure that you don't have any chances of injuries, right? Perfect. So now make sure that your mat is laid and we're going to go on the floor and I'm going to show you a few exercises which are great for you during pregnancy, which you can do on the floor. I'm going to move my camera down to join me on the floor so that you can see. Perfect. All right. Sounds good. Awesome. So the first exercise that we're going to do on the floor is what I call the Cat and Camel Pose. Again, an excellent exercise for back pain. Okay, let me show you how it's done so that you kind of have a general idea and you can do it comfortably at home as well. So we get onto all fours. We are on all fours. We're going to make sure that my knees are hip distance apart. My arms are right under my shoulders and my back is nice and flat. Okay, so let's try this. Ready? Let's go. Arch. Can you see that nice little curve in my lower back? And slowly round your back out. Look down at your navel. You have a nice camel hump there. That's awesome. Hold that stretch. And let's try and arch. Look up at the ceiling. Make that little curve in the lower back. Hold it. Now, if you're feeling a stretch right here in your abdomen, that's completely normal. And especially if you're in your 9th month, you're going to feel it a lot more. If it's painful, then don't do this. But if it's just a stretch, then it's perfectly all right. And let's round. Make that camel hump. Perfect. Once again, arch. Make that camel hump. Make that cat pose. And then round. And make the camel. Great. Come back to your starting position. Sit back. Now, when you're sitting back, this is called your Vajrasana position. Very famous and popular in yoga. Now, why am I doing Vajrasana during pregnancy? I've heard a lot of myths from mothers who say that I've been told not to sit like this. It's going to be a problem. That's not true at all. In fact, we recommend that post your meals, you should sit in a position like this because it is going to help you to digest your food better. It will reduce your acidity and bloated feeling, right? So 15 to 20 minutes after your meals, if it is possible, sit like this. If you find it uncomfortable, you can put a pillow right here, or you could put a pillow between your legs like this, and you could sit back, right? So as long as you're holding your back nice and erect, it is going to help to separate your stomach from your food pipe, which is going to help you to have less incidence of acidity. Okay. The next posture we're going to show you is the butterfly position. So you're going to bring both your feet together. The idea is that your feet are as close to the pelvis as possible. Can you touch right there? Absolutely, as close to the pelvis as possible. And your knees have to be as low as possible, right? We're going to make you split dancers. That's something which is going to be awesome, right? Ready? Hold it there. So this is the first position where you can hold it. And then you could also flap slowly. So that's like a gentle up and down, 2 and down, 3 down, 4, down. And to do variation, you can do 2, 3, 4, 5, 6, 7, and 8. You know how I would recommend you do this exercise? Do it while you're watching TV, do it while you're talking on the phone. When you feel that your legs are feeling a little jammed, you could just simply straighten them out, shake them out, and then you could do those ankle flexes and etc. Let me show you what I mean by that. Right? So sit in a comfortable position, point your feet and flex. 2 and flex. 3 and flex. 4 and flex. And you can circle. Nice circles. 1, 2, and 3, and 4. Reverse the circle. 1, 2, 3, and 4. Right. Perfect. One more exercise. And then we're going to get into something a little bit more easier with less movement issues. So let's lie down on your side. What I've done is I've folded my lower leg. I've not kept it straight. I'm going to fold it and the upper leg is straight. I'm going to show you one leg and it's understandable that you're going to do the other leg also. Okay? This is also a great exercise to improve flexibility in the pelvis region, right? So keep your body stable, don't wobble back and forth. And what I want you to do is raise this leg up to 90 degrees. Remember the geometry that we learned in school? That's exactly what we're going to do. Raise it up and down. 2 and down. 3 and down. 4 and down. Right. How many counts are we going to do? We're definitely going to start with 8 to 10 counts. And then once our strength and stamina increases, then we're going to increase this to doing at least 24 to 32 counts for each of our legs. So it all completely depends on how you feel comfortable. Now, some simple things that are also necessary for pregnancy, even though they may seem very simple. The first one is your Kegels. Now, it's very, very impossible for me to show you what a Kegel is, but Kegels are your pelvic floor exercises. They're your vaginal exercises. So all you have to do is imagine that you're stopping the flow of urine. Don't do it actually. Don't do it in the bathroom at all. That's like an absolute no-no, all right? So make sure that you're doing it on the bed. Just imagine that you're stopping the flow of urine. Hold and release. Now, when you're holding, your abdominal muscles should not become tight. Your abdominal muscles should stay relaxed. Like I'm doing my Kegels right now, but you can't see anything, right? I'm absolutely comfortable. I can talk, I can breathe, I can, do other things while I'm doing my Kegels. That's how easy it is supposed to be. Should we try a few together? Hold, release. Hold, release. Hold, release. Hold, release. How many am I making you do? Now you're going to have a shocker. Anywhere between 100 to 150 every day. Because these exercises are important for pregnancy. It will help to prevent urinary incontinence. It is excellent for the second stage of labor. It will help the baby to come through faster. And it is absolutely essential for post-delivery recovery because it makes your vagina go back to shape faster. And it's not over yet. It's even excellent for you to do this when you're older, my age, for example, because as we grow older, our muscles become weaker. So we don't get urinary incontinence or uterine prolapse problems later in life when you are my age and beyond, right? So that's something which is very important to do. Do it on a regular basis. I love to tell all the mothers this, that today we have met for the first time. I've taught you this particular exercise. And because of this one, you're going to remember me for the rest of your life. Right? All right, awesome. So now the next thing we're going to do is deep breathing, which is very, very helpful to improve your lung capacity. I'm sure you feel breathless during pregnancy a lot. So that's important. And it will also help to tone your abdominal muscles. So close your eyes. Keep your hands like this so that you know what you're doing. You take a deep breath in very slowly, deliberately, all the way till your lower abdomen, and then you exhale. Okay? So close your eyes. Ready? Take a deep breath in. Don't hold breath anywhere. Just go all the way in. Exhale. Inhale. Exhale. To feel your hands rising and relaxing. You should feel your body filling up like a balloon. Keep going. And then the balloon empties out. So it's inhale. Fill up that balloon. And exhale. The balloon blows out. Just try a couple more. Deep inhalation. Exhale. Inhale. Exhale. Right? When am I going to do this? I want you to do this first thing in the morning. For all the other exercises, I didn't say anything. You can get up in the middle of the night and do them if you like. But deep breathing is best done in the morning because the air is expected to be fresh. Don't do it in an air-conditioned environment, and do about 40 to 50 deep breaths every day. That's going to help to give you a lot of benefit as far as your breathlessness is concerned, as far as your feelings of the lungs being all full and preparing your abdominals for the actual pushing and holding the baby. That's something which is very, very essential. All right. So these are a few very simple, easy to do exercises which you can do during pregnancy. Once again, I'm going to remind you, you definitely need to ask your doctor about when you can start, and make sure that you ask with every visit. If you feel any discomfort or you notice any of the warning signs, then please stop and connect with your doctor and then resume your exercises, right? Awesome. So what I'm going to do now is I'm going to go back to my presentation and show you a short video. And we also have a little gift voucher for you. So I'm going to share the details of that with you. And then we'll start taking questions. And I'm sure Dr. Ganga is waiting to join us as well.
When is a parent born? When your world changes in a moment? Nani? Or when the moment is celebrated by all? When you start learning again? Or with a new role? Is it your child's first breath? Or is it just a feeling? Parents are born when they fulfill a responsibility.
Your child's umbilical cord blood can provide protection from 80 life-threatening diseases. Keep it safe with Asia's largest stem cell bank, Cordlife. One chance, one choice.
All right, so that was a little bit from Cordlife, the stem cell banks, and we have this exciting voucher for you from Bunbury. And you know what Bunbury is? It's an eco-friendly diaper, which means that you can actually wash it. Amazing, isn't it? So when we have our mothers, mother-in-laws, older generation at home, they don't want you to use diapers. But we young mothers, we want the convenience because we know that babies are going to get wet and they're going to be cranky. So how do we strike a balance? Try this out. You can look at getting a Bunbury diaper and experiencing the benefits of a diaper along with the benefits of a cloth nappy. So mother-in-law is happy and you are happy. And of course, baby is happy too, right? So make sure that you get a good use out of this voucher as well. These are some books that have been that are available, which I have written, which are in the market. Prenatal Fitness, which is a complete book on exercises for pregnancy and post-delivery with pictures and explanation. It's available on Amazon. Parenting Mantras is for post-delivery, all about your baby and you and recovery and all of those things. And there is the recipe book for babies, that is after they start eating solids. So these are some options that you have, and you can definitely consider picking them up. We are going to now welcome Dr. Ganga and open the floor for questions. I'm going to leave the screen open. It's got my personal contact details on it. And I've also put in all the contact details of Cordlife so that you can get in touch with them for your voucher, for the recording of this session. But give them 72 hours because they have to organize all these things, right? So in about 72 hours, somebody will surely be in touch with you. And if you'd like to take a presentation, you can do that as well. So I'm going to start with the questions, and I hope there are lots of them. And I'm sure that you're going to keep us busy with all your questions. Thank you, Dr. Ganga, for joining us.
Sonali, thank you so much. That was really a very wonderful and informative session for all our expecting moms. Yeah, good afternoon, everyone, all expecting moms. And really, it's a nice opportunity to you're able to see me nowadays because of the COVID. Not able to see each other. Now I got a chance, my patients got a chance to see me. I'm happy about it. And Sonali really made us really very informative session it was. Indeed, I also have learned a few points about your yoga session. And it gives a good information for the expecting moms. And it was very good to see you doing all that exercises and showing it to the patients, so that it is very, very easy. Because most of the times, many of my patients ask me, ma'am, how to do the squats, how to do the butterfly exercises. Most of the patients now know about these. Now it's a good awareness, and everyone knows most of the times these exercises. But everyone have a doubt regarding like how to go about it, and they're little hesitant to start about exercises. So it's really good to see like an expert like you showing them and explaining in each and a benefit of each and every yoga pose. That was really very much helpful.
Thank you so much.
And I should again stress about, thank you, Sonali, for that. And I should really tell you about what all you told. That's really very good about the yoga benefits. I want to stress more about this yoga. Like I have seen, we have been encouraging the patients doing this yoga, who are all doing, have really having very good outcomes. Like they are getting good normal vaginal delivery, and the pain factor is also very less, and they're having a very good experience throughout this birthing process. What happens, this yoga, it gives a lot of flexibility and a strength to all the pelvic floor muscles. That is the main thing, the main factor which is needed for the birthing process. And it will improve the blood circulation to the uterus, and the baby growth also will be very good. And it's very nice that you even pointed about all the myths they have in pregnancy in starting a yoga. Like the problems, like it can lead to a miscarriage. They're all myths. That's a very clearly you have taken a nice poster on that, on nice presentation. So never hesitate to do a yoga. But only few of the questions, sometimes the patients, they have a doubt. Like there's only 3 points which you need to remember when you should not do yoga. Like always, first you consult the doctor and just check whether everything is going on good with you, all your blood pressure and your baby position, these. And 3 important things when you should avoid doing the yoga is whenever you have a lower abdomen pain. So sometimes they can be, for some patients, very rarely, a preterm contractions of the uterus, like whether if they had a previous kind of history of preterm delivery. So those are the patients not suited to do yoga. And the very important second point is whenever the placenta is low lying. Some conditions the placenta is low lying for some patients. So usually what happens, as the uterus grows, the uterus will pull up the placenta, but it will take some time. So you have to wait for that. You have to consult your doctor. You have to make sure that everything is good around the baby, the placental position. And the third point is whenever there is a stitch over the cervix, sometimes there are indications where the patient may need a stitch over the cervix. So we use that stitch. So that time patient knows that, okay, she has undergone this stitch. So only that kind of patients should avoid doing this yoga. And yoga has a more benefits, even like it will help you to relax all your muscles, and that way it will reduce your anxiety. Now with most of the times now we see the mothers are working mothers now. So most of the times you're before your screen, and you don't find time much for yourself. So, but you have to make sure that you have some time for walking. Yeah, walking is also a very good exercise that everyone can do, and it's a very simple. As Sonali has clearly explained, you have to have a proper walking shoes and you set up time on your clock. Now, most of the patients also ask like whether can we go out and do the walking. One point I would like to say at this COVID time, it is better do at home. Just fix up your time on your wall clock and maximum distance available at your home. Take that distance and just keep walking around. So this will help you to do the walking, improve the blood circulation. All your ankles and all will be very free. All your joints will be very free and there will be less chances of getting edema on your lower limbs. This is a very common complaint we see in many of my patients complaining of little kind of edema is normal in the lower limbs. But when you do about all this and be active and this, for small activities and all at home also you should get up yourself immediately and just taking up some small work. I advise all my patients to be active enough. Do all your regular works at home. And important is this walking and the yoga. So practice daily yoga. Yoga has got very good benefits. So it will improve your sleep also. So most of the times you are on the screens, your eyes are tired. So you will get very good sleep after doing this yoga. And it improves the strength and the flexibility of all your pelvic muscles and the joints, which are very important for the birthing process. So I think you should start doing and always check with your doctor when you have to start. Usually first 3 months I advise, okay, just do walking. Once everything is okay about the baby, growth is all okay, then I advise to start the yoga. Okay,
Great.
Sonali, so is there any questions? Are there any questions?
So far, none of the mothers seems to have popped in questions, but maybe I can ask you a few, which generally I hear mothers, so these are some myth busters since we've been talking
Yes.
so much about how yoga and exercise prepares us for labor. Some of the
Yes.
questions that mothers generally have, first and foremost, when should I come to the hospital? As soon as I
Yes.
feel the first contraction, or can I wait at home?
No, actually, this is a very good question, Sonali. So most of the mothers have a doubt. So, like, see, everyone will have a different kind of pain perception, right? So some patients, even they have good contractions, they'll be able to perceive it is very milder. And more important is that pain perception so is very less for some patients. So whenever they feel that okay, I am feeling the contraction, I am feeling the pain, better always come to the hospital and check with the doctor. Okay, we have a very good NST and the CTG monitor. In that we will check whether the uterine is getting contraction. We'll be able to record the contractions really. So sometimes there are false pains like they come and go. Okay, but sometimes these false pains usually so most of the time they will turn into the two contractions. So they should
Right.
understand this one point. And one more point is whenever they have any leaking of the amniotic fluid, which is the amniotic bag which is around the baby, to be carrying the baby. So whenever there is a discharge like watery discharge, so all the clothes will get wet. This is the point they have to reach the hospital. And one more thing is a bleeding from the uterus that it is easily understandable by the patient herself. With that, any problem with that kind, also immediately they need to reach the hospital. And movements of the baby. This is a very important point. All the mothers in the 9th month should understand. Baby should be kicking you at least around 10 times in 12 hours. Okay, this is the
Right.
point you should understand. Yeah, at a stretch, if you don't feel the baby movements, it's the time that you visit the hospital, check your baby's heart, and you can go about with this NST monitoring. In that, we will come to know exactly what is going on with the baby. Yes,
Right.
Sonali?
So another question that mothers generally have is why is labor different in terms of hours for some women? Like, some women will go and 2 pushes and they'll say the baby is out. And some women are in labor for like
Yeah.
24 hours. So what is the mystery behind that? And how do I get that two
Yeah,
pushes?
Sonali. That's what this is all your expertise comes into play here. That's what yoga will help for improving this kind of the hours which you are saying that will take for the birthing process. So for the priming means the first birth for every woman it is little longer, like the muscles and all not prepared for the childbirth, right? So the cervix is not yet prepared. So the cervix has to get priming. It has to become soft. Then the head should come down and then again the contractions should go on properly regularly. So usually we assist in this kind of contract. If they have less contractions, we will have add the medication to increase the contractions. If they're getting good contractions and the cervix is smooth, soft, and also usually it will finish in some around 8 to 12 hours for a first delivery. Second delivery is always, as you said, already the pelvic muscles are prepared, and if the cervix is already a little soft, and the process will be a little faster compared to the first one. So the yoga is the main key to faster your birthing process.
Right. So I have had a lot of mothers ask this question. Nowadays cesarean sections are so easy. Why should I go through all the pains? Why don't I just have a planned C-section? Anything you want to say to that for them, ma'am?
Yeah, see, they never think that cesarean is an easy process. Always a natural, normal birth is always natural and good for a mother. So this will help you to tone up your muscles and get back to your normal work and on whatever if you're working or normal mother at home. It will help you to get back to your normal very easily for a normal delivery. Cesarean is always you're cutting open your abdomen, so can be sometimes complications, and sometimes there can be problem in the healing of the stitches, and sometimes there can be blood loss more, which I mean to go for blood transfusion. So many things come up when you're going for a but sometimes we have to do the cesarean to help the mother and for the baby, and in some indications we have to go for cesarean, that for sure then we have to do. But when you have an ability, when you have a chance to have a normal delivery, you should try for a normal delivery. Never think about a cesarean. I'll never allow my patients to think about a cesarean. Always I will ask them, no, you have to go through the normal process of the delivery. It's only on about 8 to 12 hours, right? Then later the whole life you are happy and you are very fast recover to your again back to your work and normal.
Right. So I think one last myth that one last burning question that mothers have, especially in this time, what is the care and precaution that we should take when we are coming to the hospital, especially in this given pandemic? Because
yes, so it's a very relevant question now. Yes.
Yeah.
So the same precautions what we are seeing through the web and all, like first thing is you have to be like first avoiding the crowded places, and you have to be most of the time at home. So yeah, the more time you're at home, you're at more safer place. Once you're out of your home, you are exposed to the virus, and all your family members also need to be very careful about the pregnant mother when is at a home. Whenever you go out, again you come back, the family members also need to take a proper shower and again go about with the mother. So most of the times is more important is you have to be maintaining the social distancing. That is the most important thing. If you have to go out, you make sure that you're not into a very like crowded places and where the places are taken by most of the public, and social distancing, just to maintain at least a meter distance from other people. And important is you have to wear a mask, and strict to no for a cloth mask. Always you have to prefer either a surgical mask or N95 mask only. And cloth mask will not give protection. Surgical mask will give almost 90% protection, and the N95 will give almost 97% protection from the COVID. And at the hospital also you have to be careful that the time of the delivery, most of the relatives, they want to come to see you. So we advise to limit all your attenders, and at home also, after going home also, at least for a month, because 1 to 1.5 months is the time which you will need, which the mother will need to recover to normalcy. So this is the time the most baby and the mother are more prone for the infections in this virus. So always limit the attenders who want to come to see you. So you can just postpone it for some time, and always do hand washing frequently whenever you handle the baby, and before handling and after handling. You have to use soap and water, frequently washing, and you can use alcohol based hand rub you need to use. So these are the important precautions you need to take when you're handling the baby and at home or in the hospital.
Yes, absolutely. So we do have one question from the audience. One of the mothers wants to know that sometimes babies are in a breech presentation. Is it possible to get it back to cephalic? And are
Your voice is breaking, Sonali. I didn't get you. Can you please repeat the question?
Definitely. Some of the babies are in a breech presentation. How to bring them back to a cephalic position?
What happens, Sonali, most of the time, baby will settle around 37 weeks. That is the time when the baby is mature. So most of the times, baby will keep moving till 37 weeks. So that is up to 15 days, even after coming to 9th month, you can wait for the baby to move and come into the cephalic position. But still, if the baby doesn't move, it is in some conditions when like the liquor is less, or with some malformations in uterus shape and all also will not allow the baby to move again back to cephalic. In that conditions, there's no other way. We have to do the delivery by cesarean, because these days we are not giving any trials for breech deliveries. Okay, always in the head cephalic only we have to try for normal delivery.
Absolutely. All right.
So this yoga also will help. Yeah, you have asked now how it will help. So yoga will help to tone your abdomen muscles, your pelvic floor muscles. That can help sometimes to change the position of the baby. So see, yoga has got so many benefits.
Right. So because active regularly, then your body is going to be prepared, and your baby will also be prepared accordingly. So definitely, if you're allowed to,
You're right,
and give permission, make sure that you kind of exercise regularly. Okay, so I have one more question from a mother. She would like to know, in case if the cervix takes more than 14 hours to open, is there any exercise to relax or open the cervix?
So does she mean in the process of labor, right?
Yes.
Yes. So there is a exercise, Sonal. I also wanted to ask you about the ball exercises. So what do you recommend regarding the ball exercises?
Okay, so the ball exercises are very good for fetal positioning, but there is nothing that we can do in terms of exercise which will actually impact the cervix. However, if you are having a long labor, changing positions helps. During labor, if you're allowed to move around, you can start doing some squats, etc. in between contractions, because what happens is when you're doing the squats, the pressure on the cervix of the baby's head increases. That can help to open the cervix. But we don't have a specific exercise which will target the cervical muscle to open up. So you have to do other things which can help. So the ball is going to help the baby to move lower. So definitely you can try that.
Yes, you're right, Sonali. Yeah, you're right, Sonali. So the ball exercises also will help the same thing. What you told about the squats, the ball exercise also will put the pressure on the cervix, so that with the weight of the baby, the cervix can soften and can open up. And sometimes we have some medications also, it will help to open up the cervix. So nothing to worry. Sometimes it gets prolonged. Just be positive and just be calm. That will only help for the normal delivery. I think Sonali is showing the squats.
I'm just showing you the demonstration. Imagine there's a ball here, and if I'm doing a ball movement, I could be doing rotations on the ball like this. So this kind of a pelvic rotation will help to move the baby down as well. But you need exercise ball to make it easier to do. Otherwise, it becomes difficult. And the exercise ball is not very expensive. It's easily available in the market. It's also very comfortable to sit on after you deliver, and it's a great tool for doing some postnatal exercises too. So it's a definite
yes, Sonali. Yeah, you're absolutely right. We are already encouraging these ball exercises during labor in our hospital. So these are the things, ball exercise and the squats during the labor process. Really, they're increasing the faster birth. It is reducing the time for the birth.
Right. Wonderful. Great. So I think we have answered all the questions, and you've answered some extra from my end as well. So thank you so much, ma'am.
Yes, Sonali. Thank you so much.
We would love to get some feedback if you've enjoyed the session, if you've liked the session, and remember to stay in touch so we can send you the recording as well as the voucher. So thank you. Have a great Sunday ahead. Stay healthy, stay safe, keep exercising, and keep smiling. That's very, very important.
Yes, right? Stay safe, and always a pregnant mother, whenever you go out, remember to wear your N95 or the surgical mask. This is the point you have to take today. Yes, Sonali?
Smile inside the mask. That's fine.
Yeah, you're right. Okay, thank you.
Thank you so much, ma'am.
Okay, take care. Bye-bye.
Bye.
Bye.